I've been working in the Family Trauma Centre since 1999, and I've seen firsthand the consequences of the mental health effects, both on children and parents in that sector. We're a regional service, a specialist child and adolescent mental health service, so I'm seeing that as a daily part of my work in so many ways. Children are affected by their parents' mental health problems, consequences to PTSD, often untreated and unidentified. Often, because we're a child and adolescent mental health service, children are being referred to us because of traumas they've been exposed to, either due to conflict-related events when we're in active conflict situation, or due to other kinds of events. But then as you get to know the family, you hear about the experience. Even last week I met a grandmother who was caring for her grandchild, and when I heard where the family referred to, we're from North Belfast. Oh, was that right? I said, did you have any troubles because of the Troubles? And then she kind of said, no, not really. And then she paused and said that actually her grandson's father was murdered in the Troubles. So it took a pause to find such a significant piece of information. And here's the next generation bringing this little boy to our centre because of concerns about his behaviour and his emotional well-being. One of the things that in these really hard-pressed times that is, I think, a huge challenge is that we continue to get resources to help adults who are continuing to suffer with troubles-related events, trauma connected to these events. I think that's really critical. But also that we really focus on primary prevention for children so that we'll have adequate services for parents of the children that are struggling because of violence in the child's early life that the parent might have been exposed to. That transmission of violence that the research has been speaking about today is evident on a daily basis in my work, both with troubles-related events and family violence histories.
I've been very interested in this research being produced in the Northern Ireland Association for Mental Health. For many years we've been working with people with experiencing mental illness, and for many of those years we've sought to recognise a link between their experience of illness and the conflict here. And so I'm very interested in that sort of story, whether there is a link between the experience of the Troubles and the prevalence of mental illness in Northern Ireland. For people who have chronic post-traumatic stress disorder, it's an incredibly debilitating illness. Often they will retire from public life. They won't feel able to go out of the home. They'll keep re-experiencing the event in a very distressing way, and so they live with very distressing symptoms. But the other important thing to say is that there are many people that we would provide support for who have experience of depression or of other kinds of psychotic illness, where there are links back to their experience in the Troubles, but they're links that they're not necessarily conscious of. So they're living with the experience of illness without necessarily being able to track it back to traumatic experiences, which leaves them feeling often very confused or disconnected from life. The prevalence of mental illness in Northern Ireland is already higher than the rest of the UK, so we know that there's something unique about this place, and I think it's fairly obvious to think that part of that uniqueness is the experience of the conflict. I suppose what's interesting about this is now there's evidence to really substantiate those thoughts that we've had in the past. The mechanism for it is in how people parent, and the way that the experience of trauma compromises the way people parent, and that's a complex thing. We heard a lot about that this morning. But part of what happens is that the experience of attachment changes. A child's ability to learn how to self-regulate changes because their parents are struggling with that themselves. So if you imagine a parent struggling with post-traumatic stress disorder, where actually their levels of anxiety or all of their psychological energy is poured into just trying to manage themselves, then obviously they're going to be constrained in the way they help and enable their children to manage difficult emotions. And if a child doesn't learn how to manage difficult emotions, it results in quite destructive behaviour as they grow up. Not only has it been disparate, but it's been significantly underfunded. I would argue that for the first 10 years after the Good Friday Agreement, we as a society were in denial about the impact the conflict had psychologically. I think people found it very difficult to talk about it. It continued to be, as it is now, very raw. And so I think that actually there has not been the focus on it that there's needed to be. Now that translates into money. This has not been funded well. I think there's anxiety on the part of government in what I've heard the phrase often, what happens when we open the Pandora's box. But the point is, we're talking about people here and people's lives. And if people have needs, it is really important that they get support at the right time. Part of the problem we have at the minute is that people have not got support early on for this, and so we're living in a society where the levels of illness are quite high, and I would argue that if there had been more investment earlier on, those levels would be lower. Every time politicians want to score a point against the other side, it is easy for them to wheel out the victims issue, and for that to be seen as something that nobody will contest. And I think in quite a cynical way, victims' issues have been politicised to allow others to score points. There are big political issues around this notion of innocent victims, or people who are victims as a consequence of being actively involved in the conflict as perpetrators, not necessarily presenting themselves initially as victims. And I think in that kind of environment, it is easy for those issues to become very quickly politicised, and the problem with that is that they then meet political ends rather than actually meeting the needs of victims and survivors themselves. We have a health service, we have an understanding and capability within the health service. What we don't have is political motivation to make this happen. This costs money, there's no doubt about it, but if there was a political will and that will was translated into proper funding and proper resourcing, we are more than able as a society to engage with these issues. What was talked about this morning I thought was quite reassuring in the sense that this is very difficult, it's very problematic, but it's not rocket science. These services already exist. They just need to be mobilised and resourced in a way that can actually be effective. Sadly, this work will have to compete with other very, very important priorities that are around. Maybe everybody will say this, but I'll certainly say this. I think this work is distinctive because it impacts on so many other areas of life. It is something that when we're thinking about families, an adult with the experience of trauma will have a profound effect on 3, 4, 5, 6 children that they bring up. Those children have an effect on their children. This becomes a cumulative thing that grows and grows and grows if we don't stop it, if we don't provide support that's important. So my argument would be this is not just about providing services to individuals. This is about stepping back and having a social programme, something that engages with all of society, that allows people to get the support that they need and that builds towards peace.